She was at the point where she couldn't shower on her own. She was walking with a walker, and she's in her early 20s, mind you. Hey everyone, Dr. Todd from Gonstead Spine Wellness. In this video, we're gonna cover a patient of ours. Her name's Kelsey. She gave us permission to talk about her case. It's a really awesome story. She actually shared her story, and so make sure that you check out her video at some point. We'll put a link here up above so you can check out her story and her words as far as what she went through. Let me tell you a little bit about what she went through, because if you've ever had any sort of adverse reaction to an antibiotic or heard of someone having this, or just someone in crippling, debilitating, acute pain, fibromyalgia type of pain, the whole body hurts, you're gonna wanna watch this video. But before we get started, make sure that you like and you subscribe. So you like the video, subscribe to our channel, share this with other people that you think this can help. Put a comment below. Comments really help us a ton. So even if you just comment, hey, great work, keep it coming, or let us know exactly what you wanna see, we really appreciate your comments. So please take just a second to leave a comment below. It means a ton to us, and it helps us get these videos out to more people who need this information for their health, okay? So we're here at our clinic, and we're here on the weekend because it's a busy place during the week. So we came in to film this over the weekend and go through and share Kelsey's story. So come on back. I'm gonna show you a couple of pieces of how this worked, because in our clinic at Gonstead Spine Wellness, we do three things. We do the Gonstead method, we do Chiropractic BioPhysics, which is curve correction, posture correction, and we do functional movement, which is that room in the back, and we'll be jumping into there in just a minute as well. So we'll show you a little taste of each area, and you can see how these three areas came together to help transform Kelsey's life. All right, so first off, let's actually start back in the adjusting room, and I can show you her X-rays. So come on back. So I'm gonna bring your attention over to this screen right here, and I'm gonna pull up Kelsey's original X-ray. All right, this is when Kelsey came in 2017, and if you watch the video that we linked out in the beginning, you'll see really how bad a shape she was in. I mean, she was at the point where she couldn't shower on her own. She was walking with a walker, and she's in her early 20s, mind you. This happened following an antibiotic reaction where her body shut down. She had a severe neurological reaction, and spoiler alert, she was helped with specific chiropractic and corrective care. Now, when she came in originally, because this is a question that patients ask us, chiropractors ask us, oh yeah, and by the way, we serve two audiences. We take care of patients, we teach people natural health and healing. We also teach chiropractors how to put functional movement and corrective exercise into their practice, which is a piece that we're gonna share with Kelsey. So check out the information below. You'll see how to reach out to us, whether you are a patient or someone that wants to learn more about your own health, or you're a chiropractor that wants to learn how to put these systems into your practice so you can help your patients at this level as well. So anyway, back to here. A common question we get is, what happens when someone comes in and they're super acute? They're in a ton of pain, you can barely touch them. What are you doing with them? Are you doing functional movement? Are you doing traction? Are you adjusting them? Well, in most cases, when someone is that acute, we are relying on very specific segmental adjusting. We do the Gonstead method. So that is my bias, is that that's what I know, that's what I do. And I feel that whatever technique or system you do as a chiropractor, or that you have found that works for you as a patient, as long as it's specific and there is a protocol to it, that's the first thing that you want to seek out. The Gonstead method is very methodical in helping us figure out, when you look at a spine like this that has all these curves and all these different issues, where do you begin? If you go back and watch some of our other patient workup videos, which I'll link one of those here above so you can click on that as well. Click on it, open it in another window so you can keep watching this video right now. On those other videos, you'll see why we have these white dots on someone's X-ray. These are actually BBs. We have smaller BBs as landmarks, moles, freckles. We have these larger BBs that designate areas of concern, areas where we find a joint problem / nerve problem, AKA subluxation, which front, back, bone, disc, bone, nerve in between, spinal cord down the middle. With trauma, the bones shift backwards out of alignment, causes the disc to swell up, irritates the nerve, okay? Lots of different things can go on here, but for simplicity right now, so all the chiropractic police out there, they're gonna give me a comment about subluxation models and whatnot. You don't need to, I understand. It's not necessarily bone on nerve. There's a lot of mechanisms, but for simplicity, the joint is abnormal, it's irritating a nerve, and there's a problem. It's affecting overall health. Okay. In Kelsey's case, she came in initially, could barely even move. You could barely even touch her. She had severe pain. I had to figure out what to do to at least help her in this initial phase. I was actually questioning whether or not we'd be able to get her out of her extreme amount of pain. She had an obvious oversensitivity reaction that was triggered by a type of antibiotic that she took. And it's a known type of reaction for those that are sensitive to this thing. Again, if you watch her story, she talks about it. So she was super sensitive. We worked on her. She even talks about in her own words, she felt like it actually hurt her more at first. But then a couple of adjustments later, something really cool happened and her pain level started to go down. We worked on her lower neck. So I believe it was her 7th cervical. We worked on T7, I believe, and T11 and 5th lumbar. We've worked on the pelvis. But starting off, I believe it was just 2 segments. I think it was C7 and T7. And that's what gave her a lot of relief after a couple of adjustments. We've gone up top and worked in the upper cervical spine. At the end of the day, she did better initially in the first phase. That was step 1. Step 2 then was exploring, can we get her more stable? Because segmentally, you can have a problem. But when you have this type of scoliosis, and when you have this really abnormal postural deformity where she shifted backwards like this, and this is her normal way of walking around, and that's what feels normal for her, that's not going to be conducive for those intersegmental joints to stay in place or to stay stable or to stay moving properly unless you address the gross postural issues. So that's why you have to address the segment and the posture and the movement too, which we'll talk about in a second. I'm gonna pull up another X-ray over here. All right, let's draw your attention to this big screen over here on the wall. We have green line, red line analysis. This is using Chiropractic BioPhysics. Oh yeah, and by the way too, make sure if there's any doubt in your mind, or if you haven't watched our previous videos and you're wondering what Gonstead Chiropractic is, make sure you watch this other video that we had where we had a chiropractor come on and challenge us and say that we were misleading the public, making them think Gonstead was something rather than something else. Gonstead is the adjustment part. We do a combination of things here. Check out the link above. Please watch that one too. It'll teach you a lot as far as how we got to this point and how this unique style of chiropractic has evolved. Anyway, back to this. Green line, red line. Ideally, she should be on the green line and she's behind. The red line is her. Green line is what's called the ideal spine model, highly researched line. This is the healthiest, most mechanically sound, most neurologically sound position for someone's spine to be in. When I say neurologically sound, what do I mean by that? I mean that right here behind that red line, going all the way down to about here, there's a big old spinal cord. The spinal cord's an extension of the brain. The spinal cord is kind of like a bungee cord. It wants to be in a nice relaxed position, but when it's stretched, do you think it gets looser or tighter? It's tighter. Do you think it gets thicker or thinner when it gets stretched? It gets thinner. So the spinal cord, when someone's posture is distorted like this, as you can imagine, the spinal cord is pulled tight. Do you think the nerves that branch off the spinal cord that control and coordinate every single cell, tissue, and organ, do you think those nerves want to have a tight and taut spinal cord? Or do you think they function better when the spinal cord is in a nice relaxed position as it was intended to be? That's right. Spinal cord tension affects overall health. So that's something else that we pay attention to. You cannot change a posture like this predictably, that's the key word, without addressing posture using usually postural corrective exercises and traction where appropriate. I say predictably because every chiropractor out there under the sun, so whether you're a patient or a chiropractor watching this, has your 1 or 2 or dozen cases over your lifetime of practice where you can show a before and after case and you say, look, all I did was adjust them, you know, and it goes back to a quote that Dr. Gonstead used to say, which I think is so relevant. He said, 80% of your patients get better if you hit them in the butt with a shovel. It's what you do with the other 20% that makes you a chiropractor. In this case, this is the other 20% for sure. This is someone that's not going to get better just by accident. So anyway, back to this. The goal now here is to look at some of these measurements, see where things are abnormal, quantify how it's abnormal, and then figure out mechanically how to start changing this. This picture right here is a traction setup. This is actually a traction card. This is something we use in office, and this is Kelsey doing her traction. And I know it might be hard to see on this picture, so I'm gonna jump out into our traction area very briefly and just walk you through what we're doing to pull her spine into an opposite direction to slowly remodel her ligament, her disc, her deep muscle, disc is a ligament, to try to get her to even have the ability to be in an upright posture, okay? As far as what keeps it there, that's where you say, well, what keeps it there? Muscular control, postural awareness, functional movement. That's why exercise is necessary with this as well. Come on back over here. Okay, so this is one of our traction units. In Kelsey's case, I'm not gonna go through every specific on this. If you want to watch a video about traction, I'll link that up above as well. We're linking a lot of videos in this one. We have one where we go through traction training with our staff and we show this in detail. So just imagine, for the most part, so she's, shifted backwards like this, like her pelvis is forward, her rib cage is back, her head's forward like this. So what we're doing is we're locking her pelvis back, we're pulling her upright like this, and we're supporting and engaging a healthy curve in her spine like so. She's in this position for up to 20 minutes. She has a process she does before she gets into this traction, which is a type of warm-up exercise, and she does this repetitiously. And she has something that she does at home as well that mirrors what she does in office. Now, do you think Kelsey was able to handle this very well when she came in horrible acute pain? No, she wasn't. It took several weeks before Kelsey was able to do this even to the smallest degree. And it took her first whole phase of care before she was, I think, conditioned enough to actually push herself to the point where this was gonna make measurable change. So in other words, she spent the first several months doing this stuff while we were handling pain relief and getting her just functional back to like baseline, where that first 3 months was just conditioning her, getting her ready so that she would even be able to tolerate doing this at the level needed to make permanent changes. So she did a second phase of care where then she was able to push herself further. We're gonna go back real quick. I'm gonna show you some pre and post x-rays so you can see where she started from day one to when she did her follow-up after doing as much as she could handle, which was on a very, very light version, to then the third x-ray, which is after she went through a more intensive phase of care and she was able to handle more. So let's run back in here. I'm gonna show you her x-rays. Okay, this was Kelsey's first x-ray, and this is her second follow-up, and this was several months later. And this is, mind you, when she couldn't tolerate a whole lot. Now, what's changing here? She's shifted forward more, now she's shifting backward a little bit. You can see that the red line, which is her, looks a little different in comparison to where the green line's at. This is still not a great improvement structurally. I'm not really thrilled with this structurally. Symptomatically and functionally, she was doing better, but we knew she wasn't done yet. This is still something that we needed to go a little further. So let me show you now that second x-ray compared to the third, which is when she was actually able to push further through traction, doing this setup right here. So now this was the middle x-ray that we just showed a second ago. That was after she was getting conditioned to be able to tolerate more, but she wasn't really able to push all that hard. Now she's pushing. And we did a follow-up. This is about 3 months apart. Okay, so a couple things I wanna draw your attention to. One is her posterior thoracic translation distance was 58 millimeters, normal is 0, so it should be right on the green line. And she improved to 49 millimeters, so she's coming forward. But a couple other things that also improved is her thoracic curve, the mid-back curve, should be close to a mid-40 degree curve. So not too much, not flattened out and too little. She had about a 58 degree curve in her mid-back. That's too much. It's called a hyperkyphosis. Her follow-up, that started to flatten out as she was brought forward into a more upright position. Now she's at 39 degrees. So remember I said mid 40 degrees is normal. That normal has a range, plus or minus a few degrees. So 39 degrees is definitely much better, within normal limits, looking better. And her cervical curve, kind of a weird shape here, like an S shape, should be a nice forward curve like this green line. You can see it really has a weird type of curve here. Starting to change a bit, still not good. So this is one of those scenarios where it wasn't something that started with her overnight. She came in because of this awful reaction to an antibiotic. The question is, and no one knows the answer to this, but the question is, was her system really weakened neurologically, making it more profound, her reaction to this drug, making it harder for her to recover? Because then when we intervened and worked on her structurally, affecting her neurological system, she started doing better when so many other things prior to that weren't helping her. So how is that possible? How could you adjust the spine and change the posture, improve movement? And mind you, it was just adjusting primarily at first. How could you adjust the spine and change someone's reaction to an antibiotic, to a drug? It's because the resilience of the body changed. The threshold in which the body was able to recover changed. The adjustment helping improve nervous system function helps someone's ability to recover quicker. It's kind of like the question of, well, are you saying chiropractic adjustments cure cancer? Absolutely not. But what I would ask you in response is, if you had cancer, would you be better off eating McDonald's every day or eating organic whole foods and juicing every day? Obviously, you would be juicing and eating organic whole foods because that puts healthier substance into your body, builds up your body, makes it stronger, and it's able to handle the additional stress of the cancer that much better, right? Similar type of thing when someone's struggling with this type of reaction. It just makes sense that if you can improve the resilience of the body, the strength of the body, it can recover and handle stresses like this more efficiently. So that's her comparative. She's doing much better. It's much improved. It's still going forward, and she's still seeing us, and we're still working to improve this further and further. Spinal health sometimes is a lifelong journey. Sometimes it's a thing where the goal is never to get the spine perfect, but it's to maintain healthy curves. It's to try to reverse the things that these unwanted stresses have caused. And having a know-how and doing things daily to maintain proper spine mechanics for the rest of the life. Again, one last thing. This is the video that I was recommending that you should watch of Kelsey's story. So this is linked in the very beginning. It's called Complications Following Antibiotic Use, turned around with specific chiropractic. Okay, and I'm gonna draw your attention to the second screen where we have Kelsey's movement assessment. I'm gonna show you what our functional movement area looks like in a second, just very briefly, and we're gonna wrap this one up. This is her movement assessment. There's 2 pages here. I'm not gonna go through every detail. I'm just showing you her overall score is 33 out of 46. So it's a 46-point score. She got 33. This was an improvement when she was more acute. Everything highlighted here is what she had previously scored. So she scored even lower on her first one, obviously, because she was in so much pain. She got up to a 33, which means she's more functional. Ideally, the closer to 46, the better as far as looking at these human movement patterns, functional movement. Functional movement in a nutshell real quick is there's 7 human movement patterns that we should be able to do properly. If you are performing these movement patterns abnormally, that's the way you injure yourself. That's the way you keep yourself injured. That's the way you pretty much negate everything we try to do here in the clinic, from the specific adjusting to the postural correction. If you just go and move in a faulty pattern, you're gonna screw that all up. So you have to address the movement if you really want to get the best results possible. Or if you're a chiropractor, if you want to help your patients the most, you have to be addressing functional movement, whether you address it in-house or you want to refer it out to someone. I don't like the idea of referring this sort of thing out because I feel like we as chiropractors are the best clinicians to manage all of these moving parts instead of rolling the dice and hoping that whomever you send your patient to, they're going to be on the same page as you, they're going to understand spinal biomechanics, so on and so forth. Okay, so that was her first movement assessment, which is 33, and then we go to the second one, and the score on that one is 41. So she came up to 41. So that means that patterns that were painful before were no longer painful, which is very important. And then some things that were dysfunctional before, like modified Thomas, that's talking about hip movement, hip musculature, whatnot, that also improved. So that's great. She's getting more functional, less pain, and that's going to ensure that she's not going to fall right back into this problem again, and that we've actually empowered her and taught her what she can be doing on her own to maintain these corrections for the rest of her life. Last thing we'll show you over here is our functional movement area. All right, this is our functional movement department. This is where our patients come in and they are taught specific exercises each and every visit. Some parts that they do back here is the warm-up process before they do traction, which we showed earlier. Some of this is some warm-up before you get adjusted, which helps to get adjusted better. And some things back here are for postural corrective exercises. So if someone shifted, then back here we're teaching them to shift in the opposite direction and start to regain normal posture and movement and more symmetrical muscular control. And then the third part is functional movement progressive exercises. You'll see we have kettlebells here. Those are our tool of choice. We use kettlebells to load these movements so that our patients can reinforce healthy movement by building strength and power. That's what the science shows. The best evidence-based research out there shows that to really get long-term correction for a patient, 1, they need to get stronger, and 2, they need to load a healthy movement pattern. Something else too that's really unique about how we put together our exercise protocols here is that we have a belt system of functional movement. So you see these belts, white belt, yellow belt, goes to blue belt, and we have patient names up here. And it goes to green belt, orange belt, black belt. See, I'm wearing this wristband. Our patients get these wristbands. This is how we make exercise more fun, more competitive. Our patients start as a white belt, and then their goal is to work their way up to get to a higher belt level as they get more functional, as they learn more protocols and more stuff here in the clinic. And patients really enjoy it. They really like it. It keeps them engaged, which is important because you can have the best protocols and the best exercises and the best rehab in the world. But if your patients don't do it, or if you as a patient don't care about it, then how much good is it really going to do you? Not that much, right? So anyway, all of that is put into place here where we address the segment, the posture, the movement at our clinic, Gonstead Spine Wellness. That's Kelsey's story. Make sure you watch her video. Make sure you go through this and click on all the different links and stuff that we put up so you can go on a fun little wild goose chase and learn every little piece of how this works, because I think you'll find it fascinating if you're searching for health as a patient or for someone that you know. I hope this information has been valuable for you. Comment, let us know what else you'd like to see. If you're a chiropractor and you want to have these sort of methods that you can offer your patients, reach out to us. MoveNowU, you'll see the link here down below. Dr. Todd signing out. When it comes to the health of you and your family, results matter most.